I am very familiar with Vasc and Angio because these are terms that you see very often in autopsy reports. This is one diagram that artificial intelligence did fine with. Remember that the arteries are shown in red and veins are shown in blue on medical diagrams, quality medical diagrams, because red indicates oxygen in the blood carried by arteries, and veins indicates deoxygenated blood in blue. The one exception to that, you should know that the pulmonary artery breaks the rule of oxygenated blood, but I won't get into that. Just know that there is an exception to the red-blue rule with the pulmonary vessels. Okay, the first word is microvascular. Micro, that's one of our prefixes. Vascular. Microvascular. Vasc is the root. Lur is a suffix that we did not study, but I'll go ahead and point it out. And micro is the prefix. Tiny, micro. Vasc, vessel. Lur is related to. So something that is microvascular is related to tiny vessels. And those tiny vessels are called capillaries, or some people pronounce it capillaries. My professor was British, so I got used to capillaries. But those are the tiny blood vessels. Sometimes they're only wide enough for a single drop to pass through. They're those little tiny veins between, let me say that again. They're those little tiny vessels between arteries and veins, those tiny, tiny little vessels. Vessels can also refer to lymph vessels. So it's not just blood vessel. That's why I didn't specify blood. But Vasc and Angio both relate to blood vessels. And I associate especially Angio with blood vessels. Okay, Angioma. An oma is actually a root that we did not talk about, but we probably should have. Oma is tumor. We talked about onc as being a tumor, but oma is a suffix root that means tumor. And then angi or angio is vessel. So an angioma is a tumor made of blood vessels or rich with blood vessels. There is a type of liver growth that's seen pretty commonly in autopsies. It's called a hemangioma. It is a growth, a tumor, made of blood vessels. If you add hema to that, or heman, you would get the root for blood vessels mixed in there. So a hemangioma is a tumor of blood vessels. It is benign, but it can bleed seriously because of the vessels. So hemangiomas can rupture and cause severe internal bleeding. Even though they're not malignant, they still can cause a lot of problems and are not uncommon in autopsies. People can live their whole lives and not know they have them. But if they get large and cause problems, they can be dangerous. Vasc and Angio.